Mr. Thompson, you're recognized.
Thank you, Mr. Chairman. Thank you for having the hearing today, and thank you to all the witnesses who came. I was thinking about some things going on in my district while you were giving your testimony. I've got some gardening programs at schools, and it's amazing to see the kids not only take an interest in it, but learn to love nutritious food that come from those gardening. I was over visiting one of the Sutter Health hospitals in my district last week and saw a pretty interesting food nutrition class program that they have to educate their patients, which was heartening to see. Adventist Health in my district is a big proponent of the blue zones, and they're pushing this, and it's all the things that we all know we need to be doing. But then we also know there's other problems. I have food desert areas in my district where you can't get good food if you know that you need to have it and want to get it. It becomes very, very difficult to purchase it. And as we all know, that the ultra processed foods are cheap, they're easy to get, and as you all have said, that triggers certain desires to eat more of those. And that's just not a good thing. And I wish that you could give us some idea how to fix those things, because we've been trying to deal with the food deserts forever. The advertising issues that you raised, good luck fixing that. You know how difficult it's been to deal with the private sector and advertising pharmaceuticals, driving consumers to drive crazy their doctors to prescribe the things that they see on television. So it's a tough one to deal with, and the education is good, but this is not new. You know, we learned about nutritious eating habits when I was in grade school. But there's so many distractions and so many alternatives that taste good and trigger those desires. So I'd be really interested in figuring out how we could figure out some policy that on both sides of this dais we could work on to get us to a more healthy population. Dr. Gearhardt, in your testimony, you discussed the impacts of a diet full of ultra-processed foods. You mentioned that this type of diet leads to physical diseases, heart disease, obesity, and also anxiety and depression. I mentioned earlier that Adventist Health in my district is a proponent of the Blue Zone project, which focuses a lot on food. Food is medicine, eating healthy. And I'd be interested to know if you know about that program and your thoughts about that, and how we could maybe mimic that in other areas to get people to eat a more healthy diet.
My pleasure. I'm not familiar with that specific Blue Zone program, but I am familiar with the research on Blue Zones, and that's looking at places around the world where people are living the sorts of lives that we're talking about here, long-term health.
That's what Adventist is trying to push, is to create those
that
opportunities and push people towards those types of eating habits.
I think that's really so essential, because we are talking so much here on the individual, and it's important to equip individuals with this knowledge about healthy eating and ways they can live better lives. And then I look at, I grew up in rural Ohio, and when I go home, we don't have a grocery store anymore. We're farmers, my dad's a farmer, but the food that we're creating is actually the ingredients that go into processed foods, and the rates of obesity and diabetes are going up so dramatically. And so taking these environmentally focused initiatives where we're setting it up for the individual where they can thrive in ways that are achievable for them, I think is really key. Because we've talked a lot about food deserts, There's also the food swamps. So if you have the one grocery store, but you have to walk past the 20 different convenience stores that are promoting this soda and the salty snack that's activating that reward system, that desire system of your brain over and over and over again to get to that more expensive, less convenient food, it's probably not going to work that well for most people. So those upper level approaches seem to be really key.
Thank you. That was a fast clock, Mr. Chairman. I yield back.